You take your blood pressure pill every single morning. Same time, same glass of water, same trust you've had for years because your doctor prescribed it and your doctor knows best. But what if some of the things you've been blaming on getting older aren't about getting older at all? What if the swelling in your ankles by the end of the day, the tiredness that never quite lifts, the dizziness when you stand up too fast, are actually your body trying to tell you something specific? Something about the very medication you trust to keep you safe? I want to be completely clear before we go any further. Amlodipine, Losartan, and Lisinopril are among the most prescribed medications in America for a reason. They work. They prevent strokes. They protect kidneys. They save lives every single day, including possibly yours. Nothing in this video is telling you to stop taking what your doctor prescribed or to be afraid of these medications. But millions of seniors take these pills faithfully every morning without ever being told what to actually watch for. Not because anyone is hiding anything from you, just because a 15-minute appointment rarely has time for a complete conversation about every possible side effect. Today, you're going to get that conversation. 7 specific warning signs. What causes each one? Which medication is most often connected to it? And exactly what to do if you recognize yourself in what I'm about to describe. Let's start with warning sign number 7, and I want you to think about Arthur while I explain it. Arthur was 76, and gardening was the thing that made his days feel worth getting up for. Tomatoes in the summer, roses he babied like they were grandchildren. Every afternoon, weather permitting, you could find him out there with his knees in the dirt. About a year into taking amlodipine for his blood pressure, Arthur started noticing his ankles looked puffier by evening. His shoes felt tighter. He figured it was just his body getting older, maybe standing too long in the garden, maybe needing to drink more water. What Arthur didn't know is that ankle and foot swelling is one of the most well-documented effects of amlodipine specifically. Research suggests this happens because amlodipine relaxes and widens blood vessels, including the small vessels in your lower legs. That relaxation can cause fluid to settle in the tissue around your ankles and feet, especially after sitting or standing for extended periods, which describes Arthur's gardening routine perfectly. Studies have found this affects a meaningful percentage of people taking this medication, and it's generally considered a known, manageable effect, rather than something dangerous on its own. But here's why it matters enough to mention to your doctor. Significant swelling can sometimes indicate that a dose adjustment would help, or that a complementary medication could offset the fluid retention. When Arthur finally mentioned it at his next appointment, almost apologetically, his doctor wasn't surprised at all. A small adjustment later, and within a few weeks, his shoes fit the way they used to. He felt almost embarrassed that he'd spent months assuming it was simply age, when it was something so directly explainable. He was back in his garden the following weekend, kneeling in the dirt without a second thought about his shoes. That's warning sign number 7. But here's what most seniors never expect about the next one. Warning sign number 6 is a persistent dry cough that doesn't seem connected to a cold or allergies. This one is specifically and strongly associated with lisinopril and with the broader class of medications called ACE inhibitors. Here's why it happens. Lisinopril works by blocking an enzyme involved in regulating blood pressure. That same enzyme also breaks down a substance called bradykinin in your airways. When the enzyme is blocked, bradykinin can build up, and for a meaningful percentage of people, that buildup triggers a dry, scratchy, persistent cough that doesn't respond to cough drops or allergy medicine because it isn't allergies at all. What surprises many people is the timing. This cough doesn't always start right away. Evidence indicates it can appear months, even years after starting the medication, which is exactly why so many people never connect the two. They've been on the pill for 2 years. The cough started 8 months ago. Nobody puts those two facts together unless someone specifically asks the question. If you've had an unexplained dry cough and you're taking lisinopril, that connection is worth raising directly with your doctor. There are equally effective alternative medications, often in a different class entirely, that don't carry this particular side effect. But that conversation only happens if you start it. Warning sign number 5 is one that genuinely changed Patricia's life, And I want to tell you what happened to her because it surprised her more than almost anyone expected. Patricia was 71, and for most of her life, church on Sunday mornings was non-negotiable. The early service, the same pew, coffee afterward with the same group of friends she'd known for 20 years. Sometime after her doctor adjusted her blood pressure medication, Patricia started feeling tired in a way she hadn't experienced before. Not just sleepy, deeply, persistently fatigued, the kind that makes getting dressed feel like a project. She started skipping the early service, then skipping church altogether some weeks. She told her daughter she figured this was just what 71 felt like. What actually was happening, her doctor later explained, involved her blood pressure medication working effectively enough that her blood pressure had dropped lower than her body was used to. Extreme fatigue is something many doctors see when blood pressure medications, particularly when doses are increased or combined with other medications, lower blood pressure more than a person's body has adjusted to yet. Research suggests this is especially common in the weeks following a dosage change, before the body fully recalibrates. What shocked Patricia wasn't the explanation. It was how simple the fix turned out to be. A small adjustment to her dosage, made carefully and gradually under her doctor's supervision, and within 3 weeks, she felt like herself again. She was back in her usual pew the following Sunday, and her friends teased her that she'd never been so happy to be handed a cup of bad coffee. If you've noticed fatigue that feels different from normal tiredness, especially if it started or worsened after a medication change, that's worth describing specifically to your doctor. Not vaguely as feeling tired, but as exactly what you just heard from Patricia's story. Specificity gets you better answers. Warning sign number 4 is dizziness when standing up, and this is the one that frightened Bernard the most. Bernard was 79. And after one frightening moment of swaying when he stood up too quickly from his recliner, he became afraid to move through his own house with any speed. He started holding furniture as he walked. He stopped standing up quickly for anything, even the phone ringing. What Bernard was experiencing has a specific medical name: orthostatic hypotension. It happens when blood pressure drops suddenly as you move from sitting or lying down to standing, and your body doesn't compensate quickly enough. Studies have found this is more common in older adults generally, and becomes more likely when taking blood pressure medications like Amlodipine or Losartan, because the very mechanism that controls your blood pressure during the day can sometimes overcorrect during these position changes. Here's what most seniors never expect. This is one of the most manageable warning signs on this entire list, once you know the trick. Many doctors recommend a simple pause. When moving from lying down to sitting, pause for 10 to 15 seconds before standing fully. When standing from sitting, do the same. This gives your circulatory system time to catch up with your body's new position. Bernard's doctor taught him exactly this. Within 2 weeks of practicing the pause deliberately, his confidence returned almost entirely. He told his son it felt like getting a piece of his independence back, just from learning to wait 15 seconds. If dizziness on standing happens regularly for you, mention it to your doctor specifically, because in some cases it does indicate a dose that needs adjusting. But the simple habit Bernard learned helps enormously regardless. Warning sign number 3 is brain fog, and this is the sign that surprises doctors the most because patients almost never bring it up on their own. I want to tell you about Eleanor before we get into why this happens, because her story is the clearest example of why this particular warning sign matters so much. Eleanor was 72, sharp as anyone in her bridge club, the one who always remembered everyone's birthdays without writing them down. A few months after her doctor increased her blood pressure medication, she started losing words mid-sentence, reaching for a name she knew perfectly well and finding nothing there, forgetting why she'd walked into a room. She didn't tell anyone at first. She was terrified. She assumed, quietly and privately, that this was the beginning of dementia, and she didn't want to say the word out loud to her children and watch their faces change. It was her daughter, noticing Eleanor repeating herself during a phone call, who gently asked when this had started. Eleanor realized, thinking back, that it lined up almost exactly with her last medication adjustment. Her doctor explained that this kind of mental cloudiness can happen when blood pressure drops more than the brain has adjusted to, because brain tissue is remarkably sensitive to even modest changes in blood flow. It wasn't dementia. It wasn't the beginning of losing herself. It was her brain, temporarily working with less blood flow than it was used to, struggling to keep up. A careful adjustment to her dosage, and within a few weeks, the words came back. She was back at bridge, remembering birthdays nobody had asked her to remember. This is exactly why brain fog surprises doctors the most as a warning sign. Patients rarely bring it up because they're afraid of what a more serious explanation might mean. But evidence indicates that when this kind of fogginess appears or worsens around the same time as a new medication or dosage change, rather than gradually over years, a medication connection is absolutely worth investigating before assuming the worst. This is not something to self-diagnose. Brain fog has many possible causes, and ruling out medication effects requires an actual conversation with your doctor, ideally one where you mention the timing clearly, the way Eleanor's daughter helped her do. But many seniors who raise this specific concern, connected specifically to a medication timeline, find real answers they wouldn't have found by staying quiet and afraid. Warning sign number 2 is muscle cramps, particularly in the legs at night, and this one is most often connected to changes in your body's potassium and electrolyte balance. Both Losartan and certain combinations of blood pressure medications can shift how your kidneys manage potassium, sodium, and other electrolytes. Sometimes levels rise, sometimes they drop. Either direction can contribute to muscle cramping, particularly the kind that wakes people up at night, gripping a Charlie horse in their calf. Research suggests this is one of the more straightforward warning signs to investigate because a simple blood test can check your electrolyte levels directly. If you've been experiencing new or worsening night cramps since starting or adjusting one of these medications, that blood test is a reasonable and easy thing to request at your next appointment. And now, warning sign number 1, the one that matters most of all. Your kidneys work quietly, every minute of every day, filtering your blood, balancing your fluids, clearing out what your body doesn't need. Most people never think about them. Most people couldn't tell you what their kidneys are doing right now because kidneys don't announce themselves. They don't ache like a sore knee. They don't tire you out the way a bad night's sleep does. They just work silently in the background until something changes. That silence is exactly what makes this warning sign the most important one on this entire list. Changes in kidney function don't usually come with dramatic symptoms early on. You might notice unusual swelling beyond just your ankles, changes in how often you urinate, or simply feeling generally unwell in a way that's hard to pinpoint. But often there are no noticeable symptoms at all until a routine blood test reveals a change that's already been developing quietly for months. This is precisely why doctors who prescribe Amlodipine, Losartan, or Lisinopril for ongoing use typically recommend periodic blood tests to monitor kidney function, especially in the first few months after starting or changing a dosage. Many doctors believe this routine monitoring is one of the most important parts of safely taking these medications long-term, even though it's also one of the easiest parts for patients to forget about or deprioritize, precisely because there's no symptom reminding them to ask. If it's been more than a year since your kidney function was checked and you're taking any of these 3 medications, that is a simple, low-stress thing to ask your doctor about at your next visit. Not because something is necessarily wrong, because monitoring is how problems get caught early, while your kidneys are still quietly doing the work you've never had to think about. And while catching a small change early means it stays small. Here is what I want you to take away from everything we just covered. These medications save lives. Amlodipine, Losartan, and Lisinopril have helped millions of people avoid strokes, heart attacks, and kidney damage that high blood pressure would otherwise cause over time. The vast majority of people who take them do so safely, for years, without serious complications. But Arthur didn't know his swollen ankles had an explanation until he asked. Patricia didn't know her exhaustion had a fix until her doctor heard the specifics. Bernard didn't know a 15-second pause could give him his confidence back. Eleanor didn't know her frightening forgetfulness wasn't the beginning of something irreversible. Understanding your own body and knowing what questions to ask doesn't replace your doctor's expertise. It makes the conversation you have with them so much more useful. So here's what I genuinely love to know. Which of these three medications do you take? Amlodipine, Losartan, Lisinopril? And as you were listening just now, did any of these 7 signs sound familiar to you? Or maybe to someone you love? Write it in the comments. Sometimes the most valuable thing in a video like this isn't what I tell you. It's what people share with each other underneath it.